And then we're gonna set the timer. Okay. All right. Hi, I'm Melody Tillier. I'm the physician assistant student that's going to be helping you out today and helping take care of you, okay?
Okay.
So before we get started, I just want to confirm your name and your date of birth. You could confirm that for me.
I'm Fazada Chipahal, and I was born on March 15th, 1997.
Okay, perfect. Just so you know, during this appointment, I am going to be taking just some notes. So if I'm looking down, I'm just writing some things down. I'm not, not listening. So just, please continue and know that I am listening, okay? So what brings you in today? What's going on?
I've just been feeling a lot of pain down my left leg. It's just running down, and like sometimes it's affecting me and how I walk. And it's been happening for like the past 3 days.
You said 3 days?
Mm-hmm.
Okay, I'm so sorry to hear that. That sounds terrible.
Yeah.
Well, I'm glad you're here today so we can figure out what's going on and get you, the proper care, okay? So you said it's affecting your walking, it's making it difficult to walk.
Right. Like I can't step on that leg.
So pressure seems to make it worse.
Yeah.
Okay. What about when you are resting? How is it then?
When I'm resting, I do feel some pins and needles sometimes. But yeah, when I get up from that position and like try to walk, like I can't.
You can't. Okay. So you said this started 3 days ago. Did it come on very suddenly or was it more gradual? How did you
I was sudden.
was okay. Was it just in the middle of the day you were doing things and then it came on? How did it happen? Walk me through.
So I went to the gym and, because of quarantine and things like that, I haven't been to the gym in forever. And so this is my first time back after a few months.
Mhm.
And so I decided to do deadlifting and like squatting with heavy weights and such.
Okay.
And so while I was like deadlifting, I did some of that and I decided to put some extra weights on. And then I left the gym, I felt fine, but then I went home, took a nap, and then when I woke up, I just like I felt it, felt the tingling, they start to come on. At first I thought it was like just my back, but then when the tingling started to go down my legs, I was just like, oh man.
Yeah, you started to think maybe something isn't quite right.
Right.
So really it seems like nothing brought it on. You went to sleep and you woke up, or did you notice anything after you woke up that might have sparked the pain?
So after I woke up, like I started feeling it.
Mhm.
But after I just went to the gym and then I came home and then it
But
just started acting up.
that was it. Okay. So pretty much it seems like the gym, you went to sleep and then you woke up with this. All right. Have you tried anything that makes the pain better or the tingling better or anything?
I had an 800 milligram of ibuprofen.
Okay. And how did that go?
It subsided for a little, but then I realized it would come back on eventually, and so
Okay.
and I didn't want to like take too much of ibuprofen, so I just kind of like stuck it out, put heating pads on my lower back.
Hmm.
Yeah.
Okay. And did the heating pads give you any relief?
Somewhat.
Somewhat. Okay. And how about what makes it worse? I know you said walking. Is there anything else or just general exertion?
Yeah, I can't really like do much. I get scared to even walk because I'm like, what's going on with my leg, you
Yeah.
know? Yeah.
Yeah, that doesn't sound very enjoyable. I'm sorry to hear that. So as it's gone on, so 3 days ago this started, you have the tingling, the pain. Has it gotten worse as time has gone on? How has it progressed, or is it unchanged?
It's unchanged. Same
Okay.
thing.
Okay. And have you ever really experienced any pain like this before in your life, or any numbness or tingling in your legs, anything like that?
Yes, I have.
Okay.
I have experienced it before. But like when I do activities that I have to exert a lot of work, I guess you can say, like it tends to be inflamed and then it acts up all over again.
Okay. So this has happened before. Has it ever been this bad?
Not this bad.
Not this bad. Okay. But the previous times you said you have the pain, the numbness, tingling, it's all pretty much the same symptoms?
Right after exertional
Okay.
activities.
And how long has that been an issue for you? How long has that gone on?
It started in high school.
Mm-hmm.
Um, like during swimming and stuff, I used to be an avid swimmer,
Mm-hmm.
and we would do like a lot of exercises and a lot of exertional things like to make your core stronger.
Mm-hmm.
Maybe some of the exercises I didn't do that well and messed something up somewhere. But yeah.
Okay. So it's been going on for a few years of your life then. Okay. You said high school, so okay. Okay. And I know you said that the pain, you have the numbness and tingling. How would you describe the pain? Would you say that it's achy, dull, sharp, shooting, burning, or something else?
It's sharp and shooting.
Sharp and shooting? Okay. Okay. Does that pain radiate anywhere? Does it travel anywhere else?
So it starts from my lower back and then it travels down my leg.
Okay. Down the leg. Okay. And just a question, after you feel that pain shooting down your leg from your lower back, is the numbness and tingling following that, or is that they're not really always related?
I think they are related.
Okay, you usually notice one then the other.
Mm-hmm.
Okay. Okay, and you said it's your left leg. And when it's in your lower back, it's your left side?
Right.
Okay. Lower back. Okay. When you have the pain on a scale of 1 to 10, 10 being the worst pain you've ever felt in your whole life, what would you rate your pain?
So I think it's like a 9, but then
Mhm.
after I take the ibuprofen, it'll like go down to like a 2 or 3. So like it's still there, but not as bad.
Ibuprofen at least brings it down a little.
Right.
Got you. Okay. And as far as the timing with the pain goes, you said it so far it's pretty much always just when you're exerting yourself. Do you notice that it is worse at night, worse when you get up in the morning, or does it change throughout the day?
It's pretty constant.
Okay. So no difference really between morning and nighttime. Okay.
No.
All right. Okay. And along with your numbness and tingling and the pain, do you have any other symptoms that go along with that?
No.
No, those are the only two things.
Mm-hmm.
Okay. All right. Okay. So I want to ask you a few more questions just about your general health and your overall health so we can get a clear picture of what's going on with you. And then we can, get the closest and best diagnosis to, get you feeling better so you can do anything. Okay.
Sure.
Do you take any medications?
No, besides what kind of meds are you talking about?
Anything. I mean, prescriptions, of any type, any over the counters you regularly take?
No, sometimes I take my vitamin pills, but
Is that like a multivitamin or is it specific?
vitamin.
Multi? Okay.
Mhm.
Okay. And how about any other supplements of any type?
No.
No? Okay. And are you allergic to anything, whether it's environmental, food, drugs?
No.
No? Okay. All right. Okay. And then I just want to ask you a couple of things about your like health maintenance. So your vaccinations and things like that. If you don't know if you're up to date on any of these things, that's totally fine. Just let me know. But if you happen to know, let me know that you are up to date on it. Do you have a recent tetanus shot or a current one?
Yes, I have.
You do? Okay, great. How about do you know if you got vaccinated for pertussis or whooping cough?
No, I don't know about that.
You're not sure? Okay. How about diphtheria or polio?
I'm not sure.
Not sure. As far as like going to school, like when you went to school, you always were you didn't have issues like with your vaccinations or any like records or anything, right?
No, I'm up to date with everything.
Okay, so anything like standard you think you got?
Yeah, everything's standard. pretty
Okay.
much.
Do you get your flu shot?
Not right now, but I will. I have an
Okay,
appointment for that.
perfect. So it's on the agenda. Do you get it every year?
Yes, I
You do? Okay, that's very good. We love to hear
do.
that. Do you know if you have ever gotten the pneumonia vaccine? Not everyone gets it.
Not sure.
Not sure. Okay, no problem. And do you know if you got the HPV vaccine?
I think I have.
You think you did? Okay, great. Okay, and let's see. Have you ever gotten the tuberculosis test? It's when they, put the little bubble in your arm.
Yes, I have.
Okay, and has that ever been positive?
No.
No, it's always been negative. Okay, great. And do you or have you ever had a pap smear?
Yes, I have.
You have? Okay. And any abnormal results, or has everything been normal?
Everything's normal.
Everything's normal? Okay. And do you happen to know if they checked you for HPV or any other things, or just they did regular?
I think it was regular.
Regular? Okay. Okay. Let's see. You're too young for mammograms and colonoscopies. Have you ever gotten your cholesterol checked with like your blood work?
I've had a normal blood work test done, but I'm not sure about the specifics.
Okay. But when you do get it, you said everything was regular? That's great. Okay. I'm going to ask you a couple questions about your family history now, so we can get an idea of how that might be affecting anything that's going on. So if you have a family history of any of these things, it would be any grandparents, your parents, siblings, and any children if you have them. Okay. So do you have a family history of high blood pressure?
Yes. On my father's side.
Your dad? Okay. Is it dad or somebody else?
It's my dad.
It is your dad? Okay. Okay. How about coronary artery disease or like heart disease?
No.
No. Any high cholesterol in the family that you're aware of?
My dad.
Dad? Okay. And how about a history of stroke?
No.
No. Any diabetes or thyroid problems?
No.
No. How about any kidney issues?
No.
No. Okay. Any arthritis in the family?
My dad.
Your dad? Okay. And anybody have a history of tuberculosis?
No.
No. Okay. Very good. And how about any asthma or any lung problems like COPD or anything like that?
No.
No. Okay, great. Does anyone get regular headaches or have a history of headaches?
My mom.
Your mom. Do you happen to know what kind of headaches she usually gets? Are they migraines or just, regular tension headaches?
I think regular migraine.
Migraines? How does she do with those?
She just takes Excedrin, I think.
Yeah. I know that they can be pretty bad, so
Yeah.
it's good that you don't get them though.
Right.
That's always a positive. How about any history of seizure disorders in the family? No. Okay. And any mental health problems or suicide?
No.
No. Okay. Any substance abuse?
No.
No. Okay. And how about any allergies?
Allergies? No.
No. Okay. Okay. And any history of cancer in the family?
Yes. My grandmother on my mom's side.
Okay.
Ovarian cancer.
Okay. Okay. And how did she do with that? Is she still living or has she passed?
Oh, no,
She passed. Oh, I'm so sorry to hear that. Do you happen to know how old she was?
62, I believe. Yeah.
Okay. And was that due to the cancer?
Mhm.
Oh, I'm so sorry. Other than your mom's mom, any other history of cancer in the family?
No.
No. Okay. Well, that's at least a positive.
Right.
Any genetic diseases that run in your family?
No.
No. Okay. So all is good there. And how about with yourself? Do you have any specific medical conditions or diagnoses or
No.
diagnoses? No, nothing. Okay. That's great. That's That's really good. We always love that. And I just want to get like, a good impression of you and who you are. So just tell me a little bit about yourself. What do you like to do for fun? Do you work? You go to school?
So I am in a grad school program that has taken
Congrats.
my life. So I used to have like a great social life, go out to eat, have a few drinks with friends, like social things of that nature. But quarantine hit, didn't get much of that. Um, so yeah, just been
Yeah.
at home.
Okay. Yeah, I think you're probably not the only one in that boat with quarantine affecting their social life.
Right.
When you hung out with your friends, what did you guys like to do together?
Um, just typical activities such as dinner, brunch. Sometimes go to the bar.
Yeah.
But yeah.
Yeah, that sounds fun. I miss that stuff. I'm sure you feel the same.
Mhm.
And you said you're in school. What are you studying?
Oh, I'm in a PA program.
Congratulations. Wow.
Thanks.
How do you like it?
It's great so far. I'm very grateful for the experience.
That's great. Do you have any idea what field you might want to go into?
I've been thinking a lot about derm, but then I started thinking about cardiology because we're studying that right now, and I kind of like get it, like it sticks with me. So I also love it. So
Yeah.
who knows?
That's great. I'm really happy that you like it. And you said that you before quarantine hit, of course, you would go to the gym regularly.
I tried to, yeah. So like maybe 3 times a week, but yeah.
Okay. And what did you like to do at the gym usually?
So I kind of split it up. I do cardio one day, and then the next I'll do like legs and then upper body. So basically, like besides cardio, I'll do weight training, I guess you can say.
Okay, great. It's really good that you vary it. Do you happen to smoke or drink alcohol? And if you do, tell me about your usage.
So I do not smoke, but I do drink alcohol. I socially, so like if I would go out, I would drink it, but besides that, I don't really drink alcohol like that.
Okay. What do you like to drink usually?
Margarita.
Margaritas are good.
Mhm.
Okay. And when you go out drinking, how many drinks do you usually have when you're with your friends?
Um, I think my maximum would be like 2.5.
Okay. Hmm. Okay. And I'm gonna just now ask you a couple questions. These are questions I ask all my patients just so I can get a full comprehensive health history from them. Um, so we're gonna start with your sexual health. Are you sexually active?
No, I'm not.
No? Okay. Have you been in the past?
In the past, yes.
And how many partners have you had? Let's start with over the last 6 months.
So last 6 months, I have not been sexually active.
Okay. How about the last year?
I feel so. Maybe the last 2 years, yeah.
Okay.
Just one person.
Okay. And was that a relationship or?
It was a relationship.
It was.
Mhm.
Okay. Okay. And were you sexually active with men, women, or both?
Men.
Men. Okay.
Men. Yeah.
Okay. And did you use protection? What kind of methods did you use?
Yes. Condoms for sure.
Okay. All right. And I'm going to now just ask you a couple questions. Moving on from there, we're going to just talk a little bit about your mental health. I like to, like I said, ask all my patients. It is quite prevalent, especially in the time we live in now. So how's your mental health? How are you doing? How do you feel?
I think I'm well. I think it's okay.
Okay. Okay. And as far as, you said you're in a graduate program, a PA program. How's your stress level?
It's very high, but I just try to like think about the bigger picture, you know?
Okay. So you're able to kind of manage it well and do good stress relief?
Yeah.
Okay. How do you relieve your stress?
By going to Starbucks, taking a walk. So I live like by the waterfront, and so the Starbucks is like right there. And um, after I get my drink, I just walk by the waterfront and de-stress.
That sounds really nice. It's a good way to de-stress.
Uh-huh.
That definitely sounds very peaceful. Um, and just one more question about the mental health. I know you said you're feeling good, but I just want to make sure in the last 2 weeks, have you felt down, hopeless, lost, things of that nature?
No.
No. Okay. Okay. And you said you live by the waterfront. Do you live in a house, an apartment?
Apartment.
Apartment. Okay. And any roommates?
No.
No. Okay. Okay. And you like your apartment? You feel safe there? It's a good neighborhood?
Yes.
Okay. Okay. And when you went to school, did you have to move away from your hometown? Is it far?
No, so I'm still living in my hometown because we're not having in classes besides just one class, so I just drive down there. It's
Hmm.
only like an hour and 30 minutes, so it's
Okay.
manageable.
Yeah, it's not so bad for once a week.
Yeah.
All right. And are mom and dad close by or
Yes.
yeah? How about how far away do they live?
I live with them.
Oh, you do. I thought you said you lived in the apartment. So
Yeah, with my parents.
oh, okay. Because when I said roommates, I'm my bad.
Oh,
I
okay.
meant anybody at
Oh,
all.
I, like that makes sense though. I didn't really like consider that.
It's okay. That was my bad. It's okay. So you live with mom and dad.
hmm
Okay. Any siblings?
Yes, I have 4 older sisters and a younger brother.
You said 3 younger brothers?
A younger brother.
Oh, a younger brother. Okay. Big family.
hmm
Do you get along well with them? Do they live at home with you?
Yeah, I do. Some of them, no, my sisters are married off, so
Okay.
they have their own places.
Their own life, their own situation.
hmm
Gotcha. Okay. And any pets at home?
No.
No. Okay. Okay. All right. And I'm just gonna now ask you just a couple things about basically like well practices. So do you use sunscreen regularly?
Yes, I try to.
You try to. I think we're all in that boat sometimes. And how about when you drive? You use your seatbelt?
Yes.
Okay. That's great. Okay. So now we're gonna jump back into your leg. I know that sounded, like it wasn't related, but like I said, we just want to, make sure we have a full picture of you so we can get you the best care. So this next section, it's gonna feel like a lot of questions. All you have to say is yes or no. And then we can go from there, okay? So first thing I want to ask is just generally speaking, is your weight your usual weight?
No, I have gained weight ever since quarantine, so maybe like around 10 pounds.
Okay. Any fevers, fatigue, or weakness?
No.
No. Okay. All right. And then with the leg pain, are you having any sort of muscle soreness there? Any pain in your joints?
So, muscle soreness in like my lower back and
Lower?
my quads, but yeah.
Okay. You said lower back and your quads. So that's all muscle soreness. What about any type of joint pain, whether it's your feet, your hip, anything in the area where you're experiencing that pain?
No joint pain.
No joint pain? Okay, great. Okay. And do you notice any like color changes in your leg? Like, does it look red or, any swelling?
No.
No? Okay. right, well, that's always good. How about any history of, oh, we're done. Stop that. Okay, let me stop the recording. Wait, where's the, oh, there it is.